You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic. He's Miami's go-to implant dentist, Dr. Ari Benmergui. Dr. Benmergui, welcome to the program.
Thank you very much. Thank you for having me. Pleasure to be here.
Now, before we get into today's topic, for people that don't know your practice, like who's the typical patient? What are the different services that you offer?
Well, we have many kinds of patients that come in. The demographic is actually very broad. We have people that come in for all kinds of treatments, such as regular cleanings, just fillings, crowns, root canals, and implants.
Okay.
We try to have the most advanced technology, so we're able to offer to our patients crowns, same-day crowns, same-day
So you have
veneers.
a machine that makes the teeth right there. Is that right?
Exactly. We take a digital impression. That means that we don't use any of those impression materials that goes into the mouth. So we're able to take digital impression, which is like a photo, basically like a photograph, a little scanner that goes into the mouth.
Like a wand camera?
It's like a little wand.
Thing?
It's like a camera, a little wand that goes into the mouth, takes a picture, it goes into a computer, and then we're able to design the crown, the veneer, whatever restoration needs to be made for that particular patient. So patients like that because they come in with a problem and they're able to live with the problem solved.
Okay, good. Now with implant, who's the typical dental implant patient that comes to see you?
Again, we get the patient that comes in that's missing one tooth or has a hopeless tooth and they need that tooth replaced with an implant. Or we also get the patients that need multiple implants. They need to replace their entire arch or the whole mouth. We also have the patients that come in with dentures that are very loose-fitting dentures. And they've had it with denture. Basically, they can't eat, they can't chew. The denture is moving all over the place. They can't go out, they can't enjoy life. And they come in and they said, I want to be able to be the way I used to be before when I had my teeth.
Now with denture wearers in Miami, or I guess in the surrounding area, are there a lot of people wearing dentures?
Oh my God, Randy. Actually, we have Dolphin Stadium.
Yeah.
You could actually fill Dolphin Stadium probably 10 times with patients that are missing multiple teeth or wearing dentures. And the problem with dentures is that, dentures are all over the place. They don't stay, people that chew. The way I see dentures
All right.
it's basically like a handicap, but it's almost like a self-imposed handicap. I don't mean the handicap that they lost the teeth by choice because, patients happens to lose their teeth is because of whatever reason. There were periodontal disease, whatever it was, they lost their teeth. But then what was placed as a replacement, you don't have to wear that. There are many choices.
So no more dentures, like we say at the top of the show. The way we know them today will be gone someday?
Exactly. The problem with dentures is like, if you compare the diet of a patient that has dentures to the diet of a patient that doesn't have dentures, that have their fixed teeth. So what happens is denture wearers, they can only eat about 20% of what people with fixed teeth could eat. Okay. In other words, they can't eat an apple, they can't chew gum, they can't eat corn on the cob. They have it, and then when they eat, everything goes under the denture. It's really debilitating. Physically, it's debilitating emotionally. So health-wise is also a problem because what happens is, of what they're able to eat, they can only chew about 20 to 25% of that. So what happens is they don't even get to digest the food properly, which leads to other problems, stomach problems and what have you. So it's a multi-fold problem. That's why I call it like a handicap. And there are choices. You can take implants, right? And you can actually go from a denture to fixed teeth, or you can even take the same denture and clamp it down, and you can avoid even having to use
like a snap-in, snap-out.
Exactly, snap-in, snap-out, and you can avoid using Fixodent, Polygrip, all those glues that are out there that, people that use it, they know how cumbersome it is.
Now we should mention, okay, so your center in Miami, I guess the way dental implants are normally done is you go to one place that does the surgery, and then another place to put the teeth on top, and maybe another place that has the imaging, but you do it all right there.
Exactly.
So aside from convenience, what's the advantage there to the patient?
Convenience is huge because patients don't like to go from one place to the next because they feel like they get lost in translation. They are like, where am I going now? Who's doing what? What am I getting? And then they ask the question, I don't know, the other guy's doing it. I didn't do it, it was him. So it was like, we get lost. The good thing about this.
So you used to do it that way?
That's the way most people do it, and that's the way I used to do it. But I'm the main doctor in my practice. And basically, when the patient comes in, I'm the one that places the implant. I'm the one that does the actual teeth that go on top of that. They get to pick the color, they get to pick the shape, they get to pick everything. So everything is done under one roof.
Now back to the denture wearers for just a moment. You say there's tens of thousands of denture wearers, close to your practice. If it's so good, dental implants, right? Why aren't they all doing it? What's your take?
Well, I wish they would all do it. But here's my take on this. The way I see it is, there are many reasons. The first reason I'm going to give you is, what happens is denture wearers, they're actually out of the system. They don't go to the dentist.
Okay.
When a person has a denture, they went through all the troubles with their teeth and everything. They finally got the denture. And when they dent the denture, they're actually out of the dental office. And they may not even go to the dentist for 7, 8 years. Why? Because they already have a denture. They have no teeth. They have no reason to go back.
Okay.
So what happens is when they come back, why do they come back? They come back because either the denture is loose or because they have sore spots. So what happens is they come into the dentist, they fix the sore spot, the dentist comes in and they basically touch up the denture, or they do a reline, and then the patient gets it back in the mouth and they get out of there. They didn't want to be there in the first place because they hate the denture and they hate being there. Yeah. So they get out of there, they don't know they have options. And that's why they're out of the system. They don't know
now,
they have.
We should mention, so this dental implant, pain, I guess everybody deals with pain differently, but this is not that much of a painful procedure. Tell me about that. Yeah, because it seems painful.
Yeah, no, the way it is right now, it's a lot easier to place an implant than to take out a tooth. It's a lot easier to place an implant than even to do filling. And right now, with all the advances in technology, we have 3D scans where we actually take a picture, an X-ray basically of the patient, and we render a 3D radiograph of the patient. We actually can place the implants on the radiograph, right?
Like on the computer?
On the computer. Okay. And then afterwards, we can actually make a surgical guide. That surgical guide basically can come into the patient's mouth, and we're able to place the implants without having to even cut the patient's gums, without being invasive, basically, is what I'm trying to say. So implants actually, I have patients that they get implants done, and that same afternoon, they're basically shopping. They're outside.
Really?
I usually don't even have to prescribe any narcotics or anything for those patients. It's like, how was it? It's like, it was great. I didn't feel anything. It was wonderful. And that's the reaction we always get. So back to your original question of why aren't all the patients coming in, the denture wearers. So another reason why they don't do it is, let's take you back to the life of the denture wearer. All right. Right before they had the denture. So for the past 15, 20 years, right before they had the denture, if you can place yourself in their lives, they actually had failed fillings that turned into root canals with crowns, then decay under the crowns, failed crowns, flaring teeth, loose teeth, bad breath. So it's back and forth, never ending, expenses, back and forth. When they actually got the denture, it was like a relief. They were like, wow, that's it, I'm done with this, I'm over. So they get the denture and they think that's it, or so they thought. Because when they get the denture, for the first few weeks, they hate the denture. It's a piece of plastic, it's invasive, they can't chew, it moves, they can't taste their food. But what happens is humans, we're very good at adapting. We're very good at being complacent with what we have. It is what it is. So if that's the way I have to live, that's the way I have to live. And the last person they want to see is me, because I'm the dentist. I'm the one that basically was treating all those problems over and over and over. And then that's what happens. And then they just fall out of the system, which is the first.
Now, is this true that, because we've talked on the phone, that for certain people on the day of the procedure, they could come in with no teeth and walk out with teeth?
Exactly. What happens is they can come in with no teeth. We can place the implants, and we right there and then we place fixed teeth on those implants, and they come out with teeth. Even if they come in with teeth that are really bad, we can actually do exactly the same thing. We take the teeth out, we place the implants, and we can load them immediately, and they actually come out with teeth that are fixed, that don't come out.
Is that right? And almost everybody does oral sedation.
Well, what happens is we have the oral sedation, so it's available for them. Some people come in and they don't get the oral sedation. Some people actually do. They come in, they get sedated, they wake up, it's done. Everything is done. They get the mirror, they're like, wow.
Is that right?
That's the way it is.
So it
never fails.
When they look at their teeth for the first time, it's like a big deal.
Let me tell you a story about a patient that I had. It's actually life-changing, because this patient came in, middle-aged, single mom, about 50s, and she was really held back because of her smile. Okay. Her teeth were really like all over the place, a lot of stains, flaring out, loose. She really was down on herself. She wasn't really like confident. She was really like held back. And she came in and she's like, you know, I need a change. I need to do something about my life. I need to go back out there. I need to start working again. And I feel like the way I look, the way I present myself, people just don't take me serious. So what were her options? Basically, her options would be actually a denture or going implants. I mean, she's actually, there's no way she's gonna wear a denture. She came in because she wants something that's better than what she has.
Okay.
And so we gave her the option of implants. So in one afternoon, she comes in and we basically took her teeth and we gave her a full set of fixed teeth in the upper. And the moment she took the mirror, she started crying. I mean, the crying reaction is normal. We actually got a lot of people that actually sit in the chair and they tear a little bit and they cry a little bit, or they hold their head and they start crying a little bit. But this one was actually crying hysterical to the point I was like, oh boy, she didn't like it. You know, she's not happy with this, what's going on? She started crying, and then it took a few minutes, long minutes, until she put herself back together. And then all of a sudden she tells me, I love them. It's nice. Actually, my mom, I wish my mom were here to see this, because I finally fixed my teeth. And it was like, wow, like it really touched me, because it was
a nice story.
Pull forward 6 months. She comes in, she went to the plastic surgeon. It was like a life-changing experience for her. She actually has a job, she's actually dating. It's another person, it's a totally different person. And it's funny, it's very incredible, because there is a statistic in implant dentistry that says 85% of people that actually get implant dentistry, in other words, they actually get a full set of fixed teeth or whatever, something positive actually inevitably happens in their life. Why? Because whatever was holding them back, it's not holding them back anymore. They feel good about themselves. And they come out and they actually, their inner smile comes out. Basically,
nice.
Their inner thing comes out. And it's like
so it's self-confidence.
Self-confidence. That's what it's all about.
Is there, and do they, so now we were talking off camera at the break that, I mean, this person, they come in, you know, after they get their teeth back, they're wearing makeup, their hair is different, they're back in the gym. I mean, that big of a deal. You see that all the time.
It's, like I told you, it's life-changing. It's all about how you feel about yourself. It's how you feel about yourself. If you don't like something about yourself, okay, you're going to be held back. If you don't like, for example, your nose,
yeah,
right, and you're very confident, self-confident about you know, self-conscious is the word. If you're self-conscious about your nose, you know, you're going to go out in a group, nobody cares about what the way your nose looks like or anything. Yeah. But just because you don't like your nose, you're actually in a corner. You're actually sort of like hiding. You know, the way I see it is the face is public property. What do I mean by that?
Yeah.
You go out, you know, everybody's looking at you. Everybody's looking at your face. Meanwhile, you can look at your whole front, but you can see your face. The one thing you can't see is your face. Now, if you don't like something about your body, you can cover it. But you can't cover your face. You can put a hat, you can put a jacket, you can put pants, you can put gloves, a scarf. But the face, you can't cover it. You can't go out with a mask, you look weird.
Yeah.
Right? So you can't cover your face, and guess what's in the middle of your face? Your smile. So if you don't like your smile, you're actually holding back.
So do something about it.
That's exactly what it is. So another reason why people have their dentures and don't do anything about it is because they actually self-diagnose. They say, you know what, I'm already too old.
How old can you be?
Oh my God. Let me tell you a story. The very first patient that we put implants on, it was during my residency. This is a 92-year-old lady, okay?
Wow.
92-year-old age.
Why would a 92-year-old want to do this?
And that's exactly my question. I didn't get it. You see, I'm a dentist, and I didn't get it. I was like, 92? Why would a 92-year-old lady get all of a sudden now wants implants for their denture? So she's there, and she actually gave me a lesson, because she actually heard when I actually asked the question to the head doctor, to the main doctor. I was like, you know, why would a 92 at this point in her life, you know, get implants? And she actually, you know what she told me? She's like, you know why? Because if I actually only have 2, 3, 5 years more to live, I want those 5 years to be the best years of my life. I want to be able to eat whatever I want to eat, corn on the cob. I want to be able to eat back ribs. I want to be able to eat whatever I want to eat. And I want to be confident in myself.
So you could be 92 years old and the implants are more likely to fall out?
No, there's no.
So that's not, age is not an issue?
Age is not an issue. Age is not,
so that woman, I interrupted you, but so what? She was either like a denture or
she actually had a lower denture. She had a lower denture, and she actually got implants to actually get a denture that actually snaps into it, because she couldn't take the floating and the moving of that denture all over the place.
All right.
So that was a lesson for me, because up until that point, I didn't get it. At that point, you're already old. Why would you want them? And
That's
she
like the best
actually,
time to do it.
And
right?
she told me that lesson. It's like, no, this is the time to do it. I mean, before, I wish I would have done it before, but now is the time to do it. I'll do it now. As long as I can do it, I want to do it. And I'll tell you what, I still didn't learn the lesson. There was this other patient that I went to take a course over somebody's office up north in the States, and they were showing this kind of new implants, new system, new technology. And the guy is showing me his patients, and this is this patient, this is that patient. All of a sudden, he shows me a patient who's in his high 80s. Now, I learned the lesson about being old and not being old. But this patient is high 80s, but he had Alzheimer's. Full-blown Alzheimer's. And he has a denture, and they give him full set of teeth, fixed teeth. And I'm questioning, it's like, what would a patient with Alzheimer's get a full set of teeth? And I asked the doctor, I was like, how come you did that to him? I mean, what's the reasoning behind it? He's like, well, let me tell you about a patient with Alzheimer's. A patient with Alzheimer's keeps losing their denture. They forget to wear the dentures. If they don't wear their dentures, they can't eat. If they can't eat, well,
they can't live,
they can't live, right? So the reason we gave him teeth is that now he's able to eat and he'll be able to live. And I was like, wow, that's so important. Fun fact.
Okay.
You know why one of the main causes elephants die?
Why?
Because they lose their teeth. Elephants get 6 set of teeth.
Oh, really?
And each set of teeth comes out, and through grinding, they grind, the teeth go away. Then the second set come out and they come forward. Then the third set, by the time the 6th set comes in and they wear away, they don't get an extra 7th set of teeth. And basically they die of malnutrition. And that's one of the reasons why elephants die, because they can't eat anymore. So eating is extremely important.
Now, do the patients that see you, so they had no teeth, they couldn't eat, and in one day they get their teeth back. Do they like the eating part or the way it looks more? I mean, what do they like more?
It depends, if it's a woman or a man. If it's a woman, they usually come in for the looks. If it's a man, they come in for the actual eating. I want to be able to eat. But it's funny, because both of them, after they have their teeth, they say, you know what? And I love the way I can eat, or I love the way it looks. I mean, it's crazy. I had this one patient that actually came in, and he came in because he had a few teeth on the top, a few teeth on the bottom, and he was wearing a partial denture, a denture with hooks that comes in and out. Mm-hmm. But the teeth that he had left, they were moving, they were giving him pain, he had bad breath, and they didn't look good. So he's like, you know what? I want to get rid of these teeth, but I want something that sort of I can chew and I can eat with. So I give him the option of, obviously, denture with implants, because he doesn't want dentures that are floating around, denture with implants, or fixed teeth. He's like, you know what? I'm already too old. He's in his high 70s. I'm already too old. I'll go for the denture with implants. So we go that way.
That means the snap in, snap out.
The snap in, snap out.
Okay.
So we head that way. I place implants on top, implants on the bottom. We make the dentures. And as I'm making the dentures, I tell him, you know what? You've been with dentures for many years already. Partial dentures are coming in and out. You know how cumbersome they are. Why don't we just go with fixed teeth? You're not gonna regret it. He took my advice.
Okay.
We ended up placing more implants, and we gave him a full set of teeth, upper and lower, full zirconia. We put him in, we place him in. All he wants is to eat. Okay. He looks at them, he's like, oh my God, I love him. I can't believe this, I love them. He leaves, he comes back a few months later, and he's like, you know what, Ari? He's like, I don't understand how people can live with dentures. I used to live with dentures, and I don't understand how people can live with denture. I mean, I wish I would have done this years and years ago. And let me tell you something about these teeth. I feel they're bionic. I mean, I can put anything and I can chew through anything. And that was like, wow. It's like, I love the way it looks. I love that I can eat anything.
So they really can't, I mean, you're saying they're made out of zirconia, so they can eat nuts.
They can eat nuts, they can eat apples with
chewy
the front
things,
teeth.
like
they can eat chewy things, okay. They can eat pizza, they can eat ribs, back ribs, they can eat anything. The guy is telling me, if I put a bone, I'm gonna break it in half. I mean, I feel they're so strong.
Good.
And I'm very happy for him. He's the nicest guy.
You're also a cosmetic dentist. So they look real.
They look very real.
You're in on the design?
Oh my God, of course. Basically, we have all the tools, And we have everything to actually, from the moment we take the impression with the little wand, to the moment of the design in the computer, to the moment of the milling, which is actually the printing of the actual teeth. We are in on everything.
Okay.
And the patient actually has a say on everything.
And I think we should mention, dental implants are not covered by like Medicare, Medicaid, even the best dental insurance isn't going to cover the whole thing. So what's the answer there?
Right, but we have financing. About 90% of our patients, they go through the financing. If you have some moderate type of credit,
Like you have decent credit,
we can actually help you. And like I said, most of our patients, they don't come in and they have the money here. No, they finance it. And it's basically an investment in yourself. It's an investment in your life. It's an investment in the way you look. It's an investment in your health.
Now, I wanted to ask you, what about the people, though, that had gum disease? That's why they lost their teeth. Are their gums too bad to do this? Or let's say they have teeth now, but the gums are really bad.
Most of the people that we get are people with gum disease.
Okay.
The reason they lost their teeth, they had gum disease, they had periodontal disease of the bone. But what we do is we basically clean all that out.
All right.
So we're able to place the implant. It's basically like a fresh start. It's like erase everything that's there, clean everything out, and then we can actually start again and we place their fixed teeth.
Now, what about if you've been wearing a denture like 20 years? Isn't it true you don't have enough bone to do this?
Put it to you this way. With the technology that's out there today, with the 3D scan that we spoke about, we're able to find bone where conventionally you would think there is not enough bone. I have a patient
So that's not an issue.
That's definitely not an
issue.
issue.
You haven't had to turn away somebody because they don't have enough bone.
It's rare. It's very rare. It's very rare that a patient will come in with no bone whatsoever. And even those patients, there are solutions for them. There are solutions for them. It may take a little longer. It may take a little more work, but there are solutions. So there are things we can do. There are bone building materials. There are many options out there that we can use to help you out. There is this one patient that came in, upper denture. She was a denture wearer for about 30 years. Bottom teeth, upper denture. And she came in because, again, for so many years the denture was loose. And she's like, I'm used to the denture. I'm like, yeah, but are you happy with it? I can eat with it. And that's about it. It moves, but I sort of manage. I'm like, well, how would you like to have fixed teeth? He's like, yeah, that's not possible. Because I've been wearing denture for 30 years and I don't have enough bone. We took a 3D scan and we basically, what we did is we gave her fixed teeth. We did that a few years ago. She was in my office.
So instead of denture, she has upper and lower teeth that don't come out.
Now she has, now what she has is she has fixed teeth on the top with the implants and she has her own teeth on the bottom.
Okay.
And we made so nice the upper teeth that we ended up having to crown the bottom teeth to match the upper teeth. And now, a few years into it, she was in my office a couple of weeks ago. And I'm like, so how do you miss your dentures? It's like, oh my God, I wish I would have done this years and years ago. It's like my youth again. I went back in time.
Good.
She loves it.
So let me ask you, if a patient goes to your office, really bad teeth, you cannot save those teeth. They have to be extracted. Or the denture wearer comes in. When they go to your office, what's that consultation like and what are their options when it comes to dental implants?
So basically, they have several options. They can go with 2 implants that would stabilize the denture. Basically, the denture would snap into the 2 implants. And I'll tell you the problem with that. Although it's a lot better than no implants, because no implants, the denture basically sits and rocks, right? 2 implants basically allows the denture to not pop up. But the problem with that is the denture will do this. It will be rocking back and forth.
Okay.
So better than that would be 3 implants, and now you create a tripod. The problem with a tripod is that, again, a table with 3 legs is not a table with like a table with 4 legs.
Yeah.
So the better option, if you're going to go with removable teeth, is basically 4 implants that snaps a denture in place. Now, what's the problem with that? The problem with that is that being that it's acrylic, being that it's a denture, dentures tend to break, tend to snap. Not only that, but as time goes on, basically food begins to accumulate under those dentures. And the dentures themselves, actually, they have little plastics that they wear off. And the denture, after a little while, becomes loose. And then they have to come back in. We have to do a reline. We have to change the plastics for them to engage again.
Okay.
So what is the best option? The best option is always fixed teeth.
Teeth that don't come out.
Teeth that don't come out. Why? Because they're in there and it's basically what you used to have sometimes is better than what you used to have.
And that's upper and lower.
That's upper and lower. I had a patient that we just finished the other day.
Okay.
Right, actually the day before I came here.
All right.
Friday, we finished. She actually had 4 implants in the bottom. Her teeth on the top, 4 implants on the bottom. A denture. I didn't do those implants, and I didn't do that denture. But she came in 2-3 times with the same denture broken. And
It was a snap in, snap out.
snap in, snap out, and it would break. And we would send it to the lab. They would repair it, put like a metal framework inside, put it back. Here's the denture again, back. So she came in, the denture broke, and she's like, "Can you please make a new denture for me, because I can't keep repairing this denture, and I need something that I can actually go away, and I'm not worried that it's just gonna break on me again." So I told her, instead of making another denture that snap ins and snap out, why don't we actually make teeth that don't come out? Fix set of teeth, the teeth that don't come out.
Yeah.
And she was like, "Can you do that?" Of course we can do that. We can make teeth that don't come out of zirconia, that are gonna be there, that you don't have to worry about them coming in, coming out, they're gonna break, they're not gonna. We actually did that. She came in on Friday. She's like, "I wish I would have met you years ago. I wish I would have done this years and years ago. I'm so happy. My whole family comes to you, but I didn't realize that, you could do this. I didn't realize this was an option."
And so how soon could they eat afterwards? Like that woman?
Right away. She can eat right away. That same day, she can go and she can actually have a steak. She can have an apple with her front teeth. She can have whatever she wants.
And we are completely out of time. Somebody watching this, right? They fit into one of the 2 categories. They're currently wearing a denture, right? You say no more dentures. Or their teeth are so bad, they don't know their options. They don't know, am I going to lose them all? Whatever. But for whatever reason, and maybe they've heard what you had to say today, they watched this, but for whatever reason, they're putting it off. They're afraid. What do you say to them?
Well, the only thing I can say to them is, don't put it off anymore. I mean, think about yourself, think about your life, think about the way you look, think about what are the possibilities for you in the future. Just do it now. Make a consultation. We can always help you.
Do they get to see you on the consultation?
I'm the one that they see. I'm the dentist.
Now, and the consultations are free consultations?
Free consultations. We don't charge for consults.
Okay.
You come in, we go over your case, we see what you have, we see what you need, and we tell you how we can help you right there and then.
Okay, good. And we have to mention again that Medicare, Medicaid, even great insurance doesn't cover dental implants entirely.
Correct.
But you have financing.
We have financing. If there is a will, there's a way. We can always find a way to help
So you have a person in your office?
We have a person in the office that's dedicated to the actual, finding the finances, basically, to finding the way to do it.
Okay, good. So I want to thank you for coming to the show.
Well, thank you
So
very much.
no more
for having
dentures.
me.
You're going to wipe
No
them
more
out, you think,
denture.
in Miami?
We're trying.
Okay. Thanks again for coming on the program.
Thank you very much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.